You're now listening to Protecting Your Nest with board-certified family medicine and obesity medicine specialist Dr. Tony Hampton. For more, visit drtonyhampton.com. Welcome to the Protecting Your Nest podcast. I am so excited to be at the beginning of a new year. It's really a time to reflect on the past and plan for the future. And if you've been listening to this podcast, you know that healing and prevention requires an understanding of the root causes of disease. In my conventional medical training, I was trained to recognize symptoms and use that information to identify the illnesses that cause symptoms my patients present with. Then I develop a treatment plan, usually using pharmaceuticals, and I later discovered that maybe that wasn't the best way to go because all I really was doing was trying to control their symptoms, you know. So this approach may work for acute illnesses like infections, but rarely does it lead to reversal of chronic medical conditions or even the identification of their root causes. So is there another way? That's the question I had to ask myself after being frustrated that many of my patients were not healing in my clinical practice. Then I discovered functional medicine, which centers on establishing the root cause of the symptoms and using this as a clue to help establish the underlying issues that generated those symptoms in the first place. According to the Institute for Functional Medicine, IFM, which is considered the gold standard of training in the field, the functional medicine model is an individualized, patient-centered, science-based approach that empowers patients and clinicians to work together to address the underlying causes of disease and promote optimal wellness. If we are to heal and prevent chronic illness, we need to see the world through a different lens. The lens of a functional medicine practitioner is what I am attempting to acquire, and exactly the lens today's guest has been using to guide how she approaches the care of her patients. Dr. Shayna Peter is a functional medicine doctor and holistic dermatology specialist who has helped thousands who have tried everything for their skin problems and have left feeling frustrated, helpless, and hopeless. She is the founder of Well Ahead Chicago, a functional medicine practice offering health, consulting, and educational resources for people who have unresolved skin conditions. Dr. Peter is the author of her newly released book, It's Not Just Acne, and has published in the Journal of American Academy of Dermatology and has spoken about holistic health on numerous stages, including Chicago Women's Magazine and the American Diabetes Association. In fact, how I met Dr. Peters is that we both were presenting for the American Diabetes Association at one of their diabetes expo at the McCormick Place in Chicago, and we actually shared a booth together. So, Dr. Peters, it's good to have you on the podcast, and I welcome you to Protecting Your Nest. How's things going for you today?
Thank you, Dr. Hampton. Thanks so much for having me. I'm so excited about this discussion.
Yeah, it's really full circle. I think at the time when we were doing our presentation, I was kind of doing my low carb thing. You probably were already kind of emphasizing functional medicine, and I hadn't really learned a lot about it. But when I decided to get my nutrition training, I learned that the root cause of disease has already been something that functional medicine practitioners have already kind of looked at. So I really use that as the foundation by which I'm sharing knowledge with my listeners. And so when I saw that you were, I'm sure you're excited about having a new book. I know how I felt. So that must be exciting for you, isn't it?
Yes, exciting, but it's like the work never stops.
I know. Yeah, anything in life that that's worth having requires work. So, but I really appreciate you taking some time with us today. So I guess we'll get started by, going back a little bit because I kind of gave a little bit of an idea to my listeners of who you are professionally. But why don't you tell me a little bit about why you decided to become a clinician in the first place?
Yeah, so I've been interested in medicine and skin health pretty much my whole life. So from a pretty early age, I knew that I wanted to go into medicine. It was just one of those things. And actually, one of my favorite things to do growing up was to read magazines and read all the skincare tips. So I've been into skincare and into medicine and nutrition for a long time.
Wow, and I remember my mom would say, "Why you always reading?" And I'm like, "Mom, this is entertainment for nerds like me and you, Dr. Peter." I'm like, "We're nerds. We like to read. We don't wanna watch the soap operas and all these other things, you know?" So,
Well, I
it's,
like both.
oh, amen to that, and you know what's funny about that? I'm a sports guy, and
Mhm,
most of my games now, I watch
mhm,
via YouTube. I'll just watch the 10-minute summary on YouTube of the
uh-huh,
basketball games,
mhm,
and then I find out Stephen A. Smith is, like, on General Hospital,
mhm.
and he's the are you familiar with Stephen A. Smith?
No.
Yeah, he's like a well, it's a sports thing, so maybe that's not your thing, but he's like one probably the top sports commentator, right?
Mhm,
And, and it's like I think it's called First Take. And he's like he was a big fan of, soap operas, and, General Hospital is what they watch, so they heard him talking about it one day, and they invited him to
mhm.
come to the show and be a guest, and then he did such a good job, they said, "Would you like to be a regular?" So,
Wow.
I thought that was really interesting. I grew up watching All My Children. My mom kinda recorded that, and we were kinda stuck watching that. So, what was
Oh,
your favorite soap opera? Anything that you
my
still like to watch?
favorite my favorite one that me and my friends were into was Passions.
Oh,
I don't know if you
really?
ever saw that one.
I've never
Yeah,
seen that one.
Passions. I forgot what channel
I'm
it used to
familiar
come on.
with it, but I never saw it, yeah.
Yeah.
That's
So
cool. Well,
that was
hey,
my favorite, yeah.
it's all good, whatever we need to relax anyway and stop reading these doggone journals, right? So that's a good thing. So I love it. So let's think a little bit about, when you think about your journey as a physician and you probably questioned conventional wisdom at some point, right? So, what was that moment for you? When did you start to question the conventional way that we treat disease?
Yeah, so I would say in my case, on some level, I always questioned it, especially in college. I majored in nutrition, and so having that background, it it gave me a little bit different perspective than probably most people going into medical school. When I was in college, I don't think functional medicine was a term yet, so it was referred to more as alternative medicine. But we used to talk about a lot nutritional approaches to different conditions, but the research has advanced so much since then, and so I would have to say that was really the beginning, and I would say the turning point, so the defining moment, I would have to say, was while I was in medical school. So, uh, dealing with some skin issues for the first time and, a few other things. And my experience being that the conventional medicine route, it really wasn't working for me.
Wasn't working. Was it
No.
acne for you, or was it something
Yeah.
different? It was
Yeah,
acne.
acne for me,
Okay.
and so that's one of the things that I talk about in a lot more detail in, the book is my story with acne, my experience with it, and the experience of a lot of my patients as well. So I think with a lot of functional medicine doctors and probably you on some level as well, you have, either a personal experience or a vicarious experience that makes you question, is this really the best route, or, is there another way that things could be done that would um, address more of the root cause and be less invasive and involve fewer side effects?
Yeah. I know, patients come to us and they don't wanna be on medication, but man, when it's it's different when it's you or your family
Yeah,
member, and you
exactly.
really don't wanna be on medicine, so now you become a detective and say, "I gotta figure this out," so it's weird, but you're right.
Exactly.
A lot of people I've had in the podcast, on my YouTube videos, a lot of times they have a personal story, so I'm not shocked at all that you also have one, but I think one of the things I wanted you to do briefly is for
Mhm.
those who are not as familiar with functional medicine, just briefly, like when you approach a patient, compared to a conventionally trained doc, what do you do different? Like, how do you approach a patient that's a little different than a traditional doc?
Okay, that's a good question. So I would say the biggest thing, especially in that first visit, is really trying to get a thorough understanding of their health history. So, in a sense, we almost kind of take the clock off the wall, throw our watch away, and just really kind of take our time to get to know the person that's sitting in front of us and what in their life and in their health history has brought them to where they are now.
Gotcha. And
And
I think
so
a lot of people struggle with that. The docs do
mhm.
because they're on this like 15-minute thing and it's hard for them to.
Exactly.
So I think that's
Yeah,
a
it's really
struggle.
hard. It's
Yeah.
really, really hard with the time constraints. So being able to allow more time in the appointment, that's going to be really critical. You can't really do functional medicine if you don't have that additional time because that part is so important, especially in that first encounter, because that's going to help you to navigate. So that's going to shape a lot of what you're going to recommend based on what you're able to get to know about that person from the
Gotcha.
beginning. Yeah, and
Okay.
so I would say also um, listening to their symptoms, what other symptoms they're experiencing, in addition to whatever their uh, main complaint that's driving them to come and see you, and really looking for connections and looking for the common denominator as opposed to looking at each symptom being something separate because it's affecting a different part of the body. So I would say kind of those two things, really getting to know the patient and really thinking in terms of connections and
Mhm.
finding the common denominator.
That sounds fair. I know as a conventionally trained doc, some of those connections I just wasn't trained on. And I know we'll touch on some of that during
Mhm.
this discussion, but I just didn't learn that there were connections that were, from other parts of the body. So I think that
Mhm.
that's a very good point. And just listening, a doctor who listens, how odd is that, you know?
Right.
And I think sometimes we don't listen because of the time constraints, but I do agree that if you patients will tell you what's wrong with them if you just listen.
Mhm.
And I think that is absolutely true. So it sounds like now we have a sense of who you are and that there was a personal story with this acne which inspired you to write your book. So that's all helpful. So let me ask you um a question about going back to what you just said. So
Mhm.
I want you to give me an example. So if a patient comes to you and they have an acne problem based on what you see in front of you,
Mhm.
what information or clues can you gather from their past that may help you understand why they have acne in the first place?
Okay. So that's a good question. That is a really good question. And it can be tough to answer because there are a lot of factors that
Right.
can
Yeah.
that can go into acne. So that's why sometimes, even though it's a very common condition and there are a lot of remedies out there, sometimes it can be one of the most difficult conditions to treat because
Mm,
there are so many factors that can play into it. So um I don't know that there's any one
like
thing.
one thing. Let me ask you a different kind of question because this is
Mhm,
what kind of when I started learning nutrition and functional medicine, one of the things
mhm,
that I hear over and over again is this idea of, did you get antibiotics when you were a kid, right? So,
mhm.
what does that, why is antibiotics when you're a kid, because you have ear infections, gonna
Mhm.
Why is that a problem?
Well, it's a problem, and I go into a lot more detail about this in the book about different things that can be an insult to your microbiome. So,
Mm,
being a conventional doctor, that antibiotics, while they might treat an infection in the short term, they can still disrupt the microbiome. You know, over
yeah,
time, especially if nothing is done to after the antibiotic course to
right.
restore things back to normal.
And you know what's crazy about that? When I was in my training,
Mm.
um, microbiome wasn't even a term that we talked about. We
Yeah.
knew that the pus had bacteria in it, but
Mhm.
we never talked about, oh yeah, it's going to help get rid of that pus, but maybe your skin has a healthy type of bacteria that you're killing as well.
Mhm.
And who'd have known that the gut would have anything to do with that as well? So I think it's just really I think for a lot of clinicians who don't have this extra training, they're just not taught this stuff at all. So it's hard for them to connect the dots. So anyway, I just thought that, it was fascinating when I learned that, yeah, your gut health matters and things like leaky gut and all
Yeah.
of that kind of stuff. I'm sure you touch on when in your book. So I'm really
Yeah, definitely.
happy. Yeah, and I'm sure you did. I did not even know what a leaky gut was. So I think that for those who are listening, there's a wealth of information to be had, and I think that if you have a skin problem, you just got to know these things and understand them so that you can fully just find other ways to help yourself out. So, but I also know that in my training, and I'm just curious about your training. So in my
Mhm.
training, and you probably know by now, I'm kind of a low carb, kind of keto guy. But in my
Mhm.
training in nutrition and functional medicine, they kind of, they don't look favorably on keto. They say it's okay short term, but not necessarily long term.
Mhm.
And I just learned, the importance of fat being a source of fat storage.
Mhm.
So obviously, people who are overweight may store more toxins,
Mhm.
and people who eat fat potentially can be eating things that have toxins in it, right?
Mhm.
But but the thing that keeps, I think, my nutrition colleagues and instructors on edge is that it still seems to be this belief that fat is associated with heart disease, in spite of the
Mhm.
fact that the College of Cardiology recently in June stated that fat's not associated with heart disease, at least when you do RCTs, those, controlled trials that are done properly as opposed to studies, epidemiological studies. So, and I've seen miracles happen uh, rather people are doing low carb, keto, even carnivore, and I've
Mhm.
seen miracles happen for people who do a plant-based approach. And what I'm finding is that if you reduce inflammation either way, you will be able to reduce the inflammation in your body and in your skin. So I guess my question to you is,
Mhm.
as it relates to your training,
Mhm.
diet and skin health, what's your
Mhm.
thoughts on diet in terms of an approach that you recommend to your patients? Does it tend to be more plant-based? Does it tend to be particular type of diet? I mean, what's your thoughts on those types of issues?
Well, here's the thing, Dr. Hampton. So I think when you mentioned, whatever reduces the inflammation, you really hit things on the head there because that's the end goal with any diet that I would recommend. Um, what I would have to say is I wouldn't say that there is one diet that I recommend to people. There are, of course, a lot of different diets out there, and I'm sure with the patients you see a lot of people doing keto or doing plant based or whatever kind of diet. What's kind of unique in my situation, because I'm looking at a lot of functional tests, is I can, hear what diet the person is telling me they are following or they've been following for however amount of time. And I can see how it's affecting their metabolism based on what I'm seeing in their test results. So based on that, I'm able to better guide them as far as, hey, you're doing the right thing, or no, you're not. Here's some tweaks that we can make that, will help to move things in the right direction. So I think that that's something that's really powerful about functional medicine is it gives you another way that you can help people to personalize their nutrition, because I think that's, the name of the game these days is personalizing things, and recognizing that a lot of these different diets that have been studied, have benefits for a lot of different conditions, but also realizing that, people are different.
Mhm,
People have different genes and they metabolize, macro and micronutrients differently, and taking that
mhm.
into consideration with what you recommend and how you guide them.
You're preaching to the choir, and on my website, it
Mhm,
says metabolic health. I
mhm,
purposely did that because although I'm a low carb person,
mhm,
I recognize that low carb is not the answer for everybody. I
mhm,
have patients who are vegan and doing quite well. And what I
mhm,
did also learn in my training is that yes, your genes are impacted by your environment. And
mhm,
so if you have twins who live in different environments, have different exposures, they may alter their genetics in such a way that it's going to manifest differently because of
mhm.
what they've exposed themselves to. So those are the little nuggets of information in this training that I'm
Yeah.
hearing in your voice, and I think that that's really critical. Another thing that was interesting is and I'm sure you talked about this in your book, but
Mhm,
in my training,
mhm,
I learned and have seen that people do really well on elimination diets. So,
mhm.
could you speak a little bit about elimination diets? Do you use that when you try to help people with acne?
Um, I would say yes and no. Well, let me back up. So, what is an elimination diet? That was the first
Yeah,
question that you were asking me. So,
yeah.
in a nutshell, an elimination diet is a structured diet where you're eliminating foods that are commonly considered allergenic for a defined period of time, whether that's 30 days or 60 days or what have you, and then you're reintroducing those. Well, when you reintroduce those foods, I guess that's more the rotation phase where you're reintroducing those foods, giving a couple days in between to see if you notice any reaction, and kind of going down the list of reintroducing those foods back in that you eliminated, and allowing a few days in between to see if you notice any symptoms.
Yeah, and it's such a logical thing, right? So I
Mhm,
remember I always joke with patients, and they
mhm,
say, "Doc, I have a shoulder pain." I say, "Well, when does it bother you?"
mhm,
Well, it bothers me when I move my shoulder this way. Any
mhm.
smart doctor would say, "Well, just don't move your shoulder that way," right? That's the answer. So so it's a similar concept here, and then you get a copay, and it just seems ridiculous, right? But the whole point is like an elimination diet is like, well, let's just eliminate everything and start from scratch, or you can eliminate certain things like you mentioned. We know that the things that for those listening, dairy, wheat, eggs, tree nuts, peanuts, soy, fish, and shellfish are like the most common allergens. And I
Mhm,
know in my experience, a lot of people do really well when you get rid of dairy and wheat and things like that. So I think it's, but like you said, it's individualized.
mhm,
And I just wanted to bring up that concept because, again, that's something I never learned in medical school. And it's like, elimination diets, leaky gut, this is all functional medicine stuff I hadn't heard of. But one thing that I hear from patients, they always
mhm,
say, well, uh, my acne would be fine, but I got a hormone problem.
mhm.
So, what would you say to a patient who says their acne is a hormone problem? Is that true, or is it kind of not really covering the bases really well?
Um, so here's the thing. So here's how I would approach that. So it kind of goes back to listening in that kind of situation, and acknowledging what the intuition that people have about their own body. So I would say a lot of times when people that they have a hormonal problem, they do, but it probably isn't just a hormonal problem, and there are probably other factors that are that they're not aware of that are causing their hormone imbalance. So um, I would say that would be the difference with functional medicine is with the hormone problem. You're not just trying to rebalance their hormones with the medication. You're investigating more to find out why their hormones are out of balance
Yeah,
and
I
what
like
steps to
that.
take to, help to
So
rebalance their hormones.
yeah, it
Mhm.
kinda sounds like a yes, it is a hormone problem, but the hormones are not what caused the problem. That's what I'm hearing you say is, like, there's a root cause to why your
Yeah, that's
hormones are
exactly
off.
what I'm saying.
That's
Mhm.
that and I always tell people come to me and they say, "Doc, I'm overweight. I have a hormone problem."
Mhm.
And they automatically think it's their thyroid. I said, "Well, you actually
Mhm.
do have a hormone problem. It's called
Mhm.
insulin." And I
Mhm.
think you're making too much of
Yeah.
that, right? And the reason why you're making too much of insulin, there's nothing wrong with the
Mhm.
insulin. You need insulin. It's because you are consuming things that require insulin. So if we can get
Right.
to the root cause of what's in your diet that'll cause you to make too much insulin, then yeah, you have a hormone problem, but we need to, that's why I like what you're saying. It's like, let's
Mhm.
focus on the right part of this. You don't have a, you know, uh, blood pressure problem or a diabetes problem. You may have a metabolic health problem, but where is that coming from? Well, a lot of times it's too much insulin, and insulin can be a disaster if consumed in
Right.
excess. So that's
And
that's kind of good to hear. And what I'm doing as I think about what to ask you, I'm like in class, right? And
mhm.
I'm thinking about the stuff I've learned because I don't think I've interviewed anybody so far who was kind of a functional medicine practitioner. So
Oh,
that's
really?
why I'm going there with you. The other thing I want to ask you about,
Mhm.
because I just finished my gastrointestinal imbalances class, and we
Mhm.
talked about, you know, that you have treatment plans, and you have to focus on different steps. For example, they
Mhm.
talked about how you have to remove things that cause the condition, then you have to
Mhm.
replace things
Mhm.
so maybe you have to remove dairy if it's that caused your skin problem, then you have to replace with the right vitamins, and then do you take that kind of approach? Do you have a systematic approach once you
Mhm.
recognize, okay, I've kind of figured out what the etiology of the root cause of this problem is?
Mhm.
Do you have a systematic approach that you learned in your training? How do you approach patients when you get to that point?
So I would say that that approach is very common. Most functional doctors, holistic doctors, naturopathic doctors, or whatever category, whatever title they use, are using some principles of that method in some way, shape, or form. Um, I'm really big on the individual piece, so
Mhm.
tailoring the recommendations to the person. So with a lot of the functional medicine testing and even um, history and learning more about the symptoms sometimes too can help you to tailor the recommendation and make it more specific to that person so that they get the best result as opposed to more of a general approach.
Yeah, that makes sense,
Yeah.
and I know that we have to do that because if I try to get, a patient to do things that is not realistic for them, one of the things I loved
Hmm.
about learning about low carb
Hmm.
versus what I was a vegetarian forever, and what I
Oh, I didn't
like
know that.
about being I mean, I love being a vegetarian, but the problem
Hmm.
was I couldn't get my African American patients to do that,
Hmm.
so now that I have more than one option, I can say, "Hey, you can still eat your ribs, but could you eat it without the barbecue sauce?" So it just gave me, because the barbecue sauce is the problem is more so than the rib. Now we can talk about grass fat and all of that kind of stuff, but in general, I found that it was easier. What I like about what I learned in functional medicine is that there is a little bit of a template, and it
Mhm,
allows you to kind of have an approach. So if I'm
mhm,
talking about the history, how do I approach that conversation? So it's really
mhm,
been very helpful. And what I also learned, because by the way, I'll be starting in January, I start classes again, and we're going to talk. One of the classes is toxins, right? And
Mhm.
so, and then I kind of got a preview of the first lecture,
Mhm.
and in that first lecture, they talked about how you can remove toxins via the skin. And I'll be honest with you,
Mhm.
when I heard naturopathic doctors talking about removing toxins from the skin, it just sounded kinda it didn't sound like real medicine to me. And then while I was listening to the lecture, they
Mhm.
were quoting studies, and they had one study where, okay, this guy, we measure his mercury and lead level, blah, blah, blah.
Mhm.
And some people who were treated with, things like sauna, for example,
Right.
then they found
Mhm.
that they had less mercury. So it's
Right.
like you can't argue with the science, but I never learned anything like that. So what's your thoughts on uh, the using the skin as a place where you can remove toxins from the body?
Well, our skin, it is an organ of elimination, whether we, accept that or not.
I didn't learn
So
that. I learned that it was just a barrier. Nobody said anything about elimination in medical school.
well, it's both.
Okay. I
So
did not learn that. I don't think. I don't
yeah.
Yeah, the elimination I learned was from the urine and from
Mhm.
the, stool, and I guess the blood in a way can get things into it to eliminate via those vehicles, but
Mhm.
nobody ever told me about the skin, so this is
Yeah.
news for a lot of people.
Yeah, so the skin is an organ of elimination, and so the skin kinda kicks in and picks up the slack when some of those other primary detoxification systems get overwhelmed.
Got you. The
Yeah.
skin. So when I see all these old guys
Mhm.
sitting in the sauna when I used to play tennis, I used to go and see these old guys. It was weird already because 'cause I'm not used to being, half necked, right?
Mhm. Right.
Sitting next
Mhm.
to people in the sauna, but I got over that after a while, but the part that was I did not understand the health benefits fully
Mhm.
until I saw the studies that said, yes, if you do this, it's going to definitely help remove toxins. We just don't talk in those terms in conventional medicine. Toxins is not a term you hear in medical school. And that's why it was hard for me to swallow. So I'm just so happy. The training you got and the training I'm getting now helps us to see
Mhm.
the world through a different lens. What about
Yeah.
there's tests that you order that I probably don't order in my clinic. I'll be ordering soon as I acquire more knowledge. And I've
Mhm.
heard, they have biomarkers in the stool, and you can look
Mhm.
for dysbiosis. And for those who are not familiar, that's just, things that, you have your normal microbiome, and
Mhm.
dysbiosis mean that it's not like it should be. So how often do you order tests like that? Even for the skin, I mean, is that like a routine thing for you?
Yeah, it's a routine thing. And so with skin conditions, it's kind of going back to the gut skin connection, and just acknowledging that inextricable link the microbiome. What we always have to remember, and sometimes us as functional doctors, we forget too, that the effects of the microbiome and the gut health, are far reaching beyond the digestive system.
Mm.
So that's what we all have to remember, um, doctors across all specialties, because we can even forget sometimes in functional medicine, but we always have to evaluate, gut health for any chronic condition.
Yeah, it
Yeah.
sounds like gut health may be the most important part of the body. Pretty much everything has to go through the gut first. But again, it's not the focus of the behavioral health doc to
Mhm.
think about the gut the way they were trained when they have
Right.
somebody that's depressed. They just think, I got to, get the serotonin up, not
Right.
recognizing that, well, most of it's made in the gut. So
Right.
it's a lot to swallow, and I just don't recall that being emphasized. And if it was emphasized, they certainly didn't tell you what to do about it. So
Yeah,
I th-
it really
what
wasn't, even with the conventional training that I had,
yeah, same
it really
thing. Yeah,
wasn't. Um, but there was something that
it-
else I was gonna. Oh, so in the book,
yeah.
um, in the book, I really go into a lot of detail about dysbiosis because one of the greatest things that I think is that we're even having these conversations now, that we're acknowledging the gut skin connection, the gut brain connection. We're
Hmm.
acknowledging all these different um, organ systems and parts of the body that are affected by our gut health. And so part of what the process that I try to walk people through, and it's not just acne, is to understand all the different pieces that can affect uh, gut all the different pieces that can affect dysbiosis
Right.
and gut health, because there are so many different factors that can play into it, things that we would never even think of if we hadn't been trained on it, like exercise, for example. If I hadn't had functional medicine training, I wouldn't automatically think of, me going out for a jog, doing something beneficial for my gut health.
Right. And by the way, it'll make you sweat too, which is good for getting rid of toxins, right? So it's like
Exactly.
all of these benefits. And that's the thing about a pill. Like a pill could target a particular part of your body, but it doesn't give you like the totality of benefits that nutrition does and that exercise does. So it's kind of a
Right.
no-brainer. My hormones are affected by adequate sleep or not getting enough sleep. So all of those things. Do you speaking of hormones, do you check like testosterone, estrogen levels? I mean, is that part of your evaluation for the skin?
Yeah, so it would be part of the evaluation.
Okay.
It definitely would. And so that's another one of the things that I discuss in the book. Is I go through several different tests, and a lot of them that people can get through their doctor, that can help to give them some really powerful insights into root
Hmm.
causes that could be contributing to their acne. And so it's been really beneficial for a lot of people in our practice, and it's been a really powerful way to take out the guesswork and help people to get results more quickly.
I like that, and I know that I mentioned some of the common food allergens. Do
Hmm.
you test for food sensitivity? Is that a valuable thing, or do you find that that's not as helpful?
Um, I do find that it's helpful. Um, with food sensitivities, there's a lot of discussion about it right now, but part of what I try to explain further in the book is, with food sensitivities, there are a lot of pieces to that as well, and they're a symptom. So I try to explain in the best way that I can the different factors that contribute to food sensitivities, and what can be done to overcome them.
That's fair, and I do
Mhm.
think like, one of the things I learned, in general is
Mhm.
that sometimes the and this is not even functional medicine, just experience.
Mhm.
Some people have a test that says they're sensitive to something, but then
Mhm.
they're still eating it, and maybe the symptoms are just not strong enough to give them
Right.
symptoms. But
Right.
so it seems like it's helpful, but then it doesn't always tell the full story. Like it may not on a practical level, it may not be as helpful as we thought it was, but it does provide valuable information because even little small micro trauma to
Mhm.
the stomach is probably not a good idea into the gastrointestinal
Yeah.
tract.
So
That's
I
kinda
would say,
yeah. What's
oh,
your
I didn't
thoughts?
mean to cut you off,
No,
but
you're good.
I would say that it definitely can be helpful for a lot of people. So that kind of goes back to when you're getting to know the patient, just kind of figuring out where they are. And are they someone who's really struggling with their diet, and, struggling with whether or not they should give up certain foods? And do you feel like they really need, a lab test to tell them, you should probably stop eating this? Because the challenge with food sensitivities, and I'm sure you could attest to this in our conventional training, uh, we didn't really talk about food sensitivities. We talked more about food allergies. And so if something wasn't causing, an obvious life-threatening reaction, we kind of just thought of it as not being a thing.
Mhm.
Um,
Okay.
and so that's where food sensitivity can be helpful. Uh, Food sensitivity testing, rather, can be helpful because it can help us to uncover reactions that are more delayed, um, that could still be causing inflammation in our body. So, because of that time delay between when we eat the food and when we notice the symptom, we may not make the connection. So, having the testing, show that we are having an inflammatory reaction to certain foods, it can be really helpful.
Okay, gotcha. Now, in my conventional training, we typically are putting some type of cream on the face. Um, we recommend birth control, because we talked about hormones,
Hmm.
medicines like spironolactone. And if the specialist is seeing a patient, they may even inject a steroid in their acne. So,
Hmm.
uh, any of the like, are you also using those approaches as well, or is it pretty much just more of a holistic root cause, and you don't have to use those approaches often?
So I don't use those approaches, and as a matter of fact, um, pretty much all the people that I see in my practice, they have tried those approaches,
Hmm.
and they either got to the point where they weren't comfortable taking it anymore. They want to go with more of a natural approach, or they are experiencing side effects. So they want to be able to come off of those medications, or even in some cases, they didn't want to necessarily take the medication, but it was helping. And sometimes people reach a point where the medications aren't working for them anymore, so then they're looking for other options for that reason as well. So those are not methods that I use when I work with people. We go after the root causes. um,
Hmm.
but I would say, with symptoms, if we're talking about just controlling symptoms, there is a time and a place for that. And I
Hmm.
would say ideally there's a combination of both, of going
Hmm.
after the root cause and doing some symptom control, because that's what's going to help people to, stay motivated. And,
Right, right,
acne is really distressing. So if you don't see any kind of improvement
right. That could
within
be,
a few weeks,
you're gonna
then
be
you
mad.
yeah, you might be ready to
Yeah.
throw in the towel
You
because
like, I'm into all some natural stuff, but I need to see some results. So that's fair. So I get that. So, um, let me ask you um, a cute question, which is, I'm a guy, so I can be a little shallow
Mhm.
at times, and we want people to look cute. So, what about makeup? I mean, do you tell people don't bother with makeup, or is there a way to wear makeup and and deal and have healthy skin?
Yeah, so you know what? I'm so glad you asked that question, because what I would say is yes, I am a proponent of wearing makeup, and here's why. So, when people have acne, especially if it's more severe, looking at their skin stresses them out. So, and it affects people's confidence too. So, I say yes, if wearing makeup, if that helps you to take your mind off of your skin, where you're not obsessing over it so much, and that helps you to feel more confident and take your place within the world, I say go for it. Part of what I talk about in the book, um, there's a lot of different things that we cover. Um, Part of what I try to educate people on in the book is a lot of the ingredients. So going back to toxins, going back to how we were talking about toxins and excreting them through the skin. One thing that's really important with cosmetics and personal care products is educating yourself about the ingredients. So yes, I'm okay with people wearing makeup. I don't discourage people from doing that, especially if that helps them to feel more confident. But educating yourself about the ingredients so you know what to look for and you can make the most informed decisions and choose the most clean products possible when you're shopping. I say that's really important.
Yeah, I know that hopefully we can do a YouTube live, and maybe during
Mhm.
that we can talk a little bit about just taking care of your skin in general and
Mhm.
answer some questions as people kind of chime in. So maybe that'll be something we'll do. And once that's done, for
Mhm.
those who are listening, we'll certainly put a YouTube live in the show notes as we've done in the past. So I guess one of the last questions I want to ask you is just,
Mhm.
people who are listening, they're, interested in looking at the world differently because of some of the things we've talked about. So, as it
Mhm.
relates to your book, it's
Mhm.
not just acne.
Mhm.
What can they expect to get from that book? I mean, for those who are listening, what would inspire them to want to pick that book up?
So I would say, in a nutshell, getting a clearer understanding of the root causes behind acne and a better understanding of why a personalized approach is so important. So this was really like a passion project for me, just based on my experience and the experiences of so many of the people that I've worked with. When I'm seeing them in my practice, a lot of the things that we're discussing, they've literally never heard it before. They've never heard it before. And, this is information that people really need to know if they're struggling with acne and they've been struggling with it for a long time. So, to the listeners out there who've been struggling for a long time with this problem and haven't gotten the answers, that they've been looking for, then this is the perfect book for them. So they can expect to have a clear understanding of root causes and some concrete action steps that they can take to start seeing improvement in their skin rather quickly.
Love it. And I guess I'll ask you the question about the Nest in a Rope acronym. And,
Mhm.
and when you think about 2021,
Mhm.
what part of the Nest and Rope would you like to focus on? Rather nutrition, exercise, your sleep habits, stress, avoiding trauma, how you think, relationships, avoiding organisms,
Mhm.
making sure your life experiences serve you, or even making sure your emotions are okay. What part of that do you think will be your focus over the next year as we enter a new year?
I would say all of the above, actually.
Yeah. You're the second
Absolutely.
guest who said that, and I'm amen to that.
All of the above, because what we all learn and what we come to realize, especially with functional medicine, is that wellness is not an endpoint. So, most of these things I've already approached at some point, but it becomes about maintenance. So making sure that I'm
Yep.
maintaining these things, and with the pandemic, it's presented some new challenges with maintaining a healthy lifestyle.
Tons. Yeah. Love it. So that's a
Yeah.
great answer. And
Mhm.
I am totally with you on that. And I actually am trying to look at what I can do better. And I know little things like sleep have made a huge difference for me. So thank you
Mhm.
for sharing your journey with us. So I
Mhm.
guess as we wrap up, any final thoughts? And of course, please let us know how we can, because I know the book is just being released. So tell the
Mhm.
listeners how they can get your book and how they can find you.
Yeah, so it will be available on Amazon January 5th. The website is it's not just acne.com, and our practice website is wellaheadchicago.com. So super easy to remember.
I love it, and I thank you, and it was nice to I'm literally, revisiting relationships through
Mhm.
the podcast. If you think about it,
Mhm.
we had some interaction via, texting and email, but I hadn't
Mhm.
talked to you until now. So it's actually this is so my podcast is just my way of catching up with old friends.
Yeah. Love
It's the
it.
weirdest thing, it's the weirdest thing, but I love it, and I learn a lot, and I appreciate you and your dedication to serving those and helping those people who have struggled, so I'm really excited that you're gonna have this project out, and again, I would ask you to scream on the podcast because I know you're excited, but
Mhm.
you'll probably in excitement, and I know I felt that way when my book first came out. So thank you again for spending a little time and sharing, your message, and, with that, I'll say a few, closing remarks, and for
Okay.
those of you who were not familiar with the concept of functional medicine, Dr. Peter has given you some insights that has likely caused you to pause and to question conventional wisdom. And in fact, that's what this podcast is all about. Let's pause and question things. And it's okay to do that because sometimes we have to turn the ship in a different direction. But imagine this, if facial conditions like acne can be treated from the inside out, then how many other medical conditions are there that we can treat that way, that we can heal from? Simply by moving away from this, let's manage the disease approach to an approach where we identify and focus on their root cause. Man, a life filled with chronic medical conditions is not your destiny. You were not born to be sick. All you need is the ability to see the world through a different lens and a clinician like Dr. Peter to guide you along your way. So what should you do? Well, I would start by making a commitment to being a continuous learner. As you acquire the knowledge you will need to protect your nest, rather by listening to my podcasts, YouTube videos, or even reading Dr. Peter's book. One thing I know for sure is that if you grow through knowledge, your ability to solve all your health care needs will be much, much easier. So I appreciate each and every one of you. I believe in you. And I feel in my heart that 2021 will be your best year ever. So, having said that, I am so happy I've been able to share this episode with you. And I only ask in return that you be well, be safe, and continue to protect your nest. You've been listening to Protecting Your Nest with Dr. Tony Hampton. For more, visit drtonyhampton.com.